Good day, everyone. You're welcome to my channel. This is Hopeful Health Channel, and as you know, we discuss about health, how to live healthy, most importantly, preventive medicine. That's what this channel is all about. So today, we'll be talking about prevention of diabetes. Yes, we can stop diabetes. In the previous lesson, we talked about regular medical checkup, and one of the checkup we recommended was going to test your blood sugar level, because the body's metabolism is always active, and you need to know if the insulin in your body, if it's active or inactive, and there are many factors that contribute to its activity or inactivity. So in this lesson, we are going to learn more on how to prevent diabetes. Thank you. So straight to the lesson. What is diabetes? Diabetes is a chronic disease that impairs how the body breaks down sugar and fats and protein, resulting in excess sugar in the blood as a result of problems with the part of the body called the pancreas, which produces hormones for sugar regulation. The hormone produced by the pancreas for sugar regulation is called the insulin. This could be from damage of the pancreas. So if it is damaged, it can lead to reduced activity or reduced sensitivity to stimulation. We now look at those factors that can put one at risk of diabetes and how to prevent it. The risk factors for diabetes are: one, obesity. So obesity causes increased levels of fatty acid and inflammation. And that leads to insulin resistance, which in turn can lead to type 2 diabetes. So there is type 1 diabetes, there's type 2 diabetes. So untreated or poorly controlled diabetes can cause other health concerns like vision problems. The person will not be able to see well. It can also lead to nerve damage, infections, heart problems, high blood pressure, and the rest of that. Also, you might ask, you want to know, how can hypertension or high blood pressure cause diabetes? Some articles have talked about how people with high blood pressure usually have insulin resistance and have an increased risk of developing diabetes compared to those with typical blood pressure. In a subsequent video, we'll talk about high blood pressure in detail. Being an African American, so there's also a tendency of having diabetes. So studies have shown that the African American has a 60% chance of developing diabetes than the average white man. Sedentary lifestyle is a lifestyle of inactivity, especially those who are into office work. They will just go to the office and just sit down from morning 8 a.m. to when they close, doing nothing, maybe just pressing their computer. Is not too good. So regularly sitting down, a life of inactivity, can lead to an increased chance of having diabetes. Right, steroid users, people who use steroid, are also at risk of having diabetes. So they have to reduce the use of steroids. Also, genetics, your makeup, your DNA makeup, how you are made. Diabetes can be controlled, diabetes can be managed. So it's better to start earlier before its onset. It's better to prevent it, because we know that prevention is better and cheaper than cure. So what are the preventive measures for diabetes? One is to lose extra weight. Secondly is to be physically active. If you are an office worker, just find some time, break time, just move your legs. You can move your legs even while you are sitting. Just move your legs. You can stand up, stretch your body, do some indoor exercise, and continue with your work. Also engage in exercise. Eat healthy plant foods. That is the best. Plants provide vitamins, minerals, and carbohydrates in your food. Eat healthy fats. An example of healthy fat is avocado pear. Avocado pear is there. You can eat that and it will not accumulate bad fat. Skip fat diets and make healthier choices. Today we hear of different diets. You hear of ketogenic diet, you hear of vegan diet. Don't just jump into any diet. The ketogenic diet, they tell you to take away like carbohydrates from your food, and eat more of other food. But at the end of the day, you cannot continue, you cannot maintain it. Just eat healthy. So be active, eat good food, eat especially plant foods. It's good for the health, and always go for checkup. Routine screening for elderly people or individual with family history. We talked about family history when you talk about genetics. If your family history, there's diabetes in your family history, you need to engage in regular checkups. Why do you need to prevent diabetes? It impairs the quality of life. It can lead to poor wound healing. You see some people having gangrene, the sore, and some people are even at the end of the day they might be amputated, because of diabetes. It can also lead to blindness, can lead also to kidney failure. Finally, it can also lead to death. So we need to avoid it to live healthy and happy lives. In conclusion, diabetes can mar your life. So mark the risk factors which we've listed and avoid them. Live healthy, live hopeful. The choice is yours. Make the right choice today. Thanks for watching. Please remember to subscribe if you've not done so. And up next, we'll be talking about how to diagnose diabetes and if diabetic. I'm going to give simple management and day-to-day way to improve quality of life. So don't forget to subscribe. It's free. Thanks for watching. Please do subscribe, like, and share. See you next time. Stay safe. Bye.